Every day, millions of Americans take a pill for high blood pressure. Two of the most common choices are Amlodipine and Losartan. Both are effective, but the side effects can be very different. One of these drugs is known for swelling in the feet and ankles. The other is notorious for a nagging cough. If you've ever wondered which one is riskier for you or a loved one, this video is for you. Just a quick note before we dive in. Everything you hear in this video is based on research from trusted medical sources, including the Mayo Clinic, Cleveland Clinic, the NHS, and the FDA. All the references are linked in the description below. This video is for educational purposes only. It is not medical advice. Always talk to your doctor about your own health situation. Today, we'll break down how Amlodipine and Losartan work, the side effects you should watch closely, and which drug tends to cause more problems in real life. Now, let's get started with Amlodipine. Amlodipine is one of the most widely prescribed blood pressure medicines in the United States. According to the Mayo Clinic, doctors write tens of millions of prescriptions for it every year. It has become one of the go-to choices for older adults, especially those recently diagnosed with high blood pressure. Amlodipine belongs to a group of drugs called calcium channel blockers. That name might sound technical, but here's the idea in plain English. Calcium normally helps the muscles in your arteries tighten and squeeze. When calcium is blocked from entering those muscle cells, the arteries relax. That relaxation allows blood to flow more freely and reduces the workload on the heart. Doctors don't only use Amlodipine for high blood pressure. They also prescribe it for chest pain, what we call angina. When someone has coronary artery disease, the arteries that supply blood to the heart muscle can get narrowed. Amlodipine helps keep those vessels open, allowing more oxygen to reach the heart and reducing chest pain during daily activity. Guidelines from the American College of Cardiology and the American Heart Association recommend Amlodipine as a first-line option, particularly for people over the age of 55. It is often more effective in certain groups, such as older adults and African American patients, compared with some other blood pressure drugs. So how well does it actually work? Clinical trials show Amlodipine lowers blood pressure in a reliable and predictable way. In one large study, patients taking it saw their systolic blood pressure, that's the top number, drop by about 16 points. For comparison, Losartan, which we will discuss shortly, lowered it by around 14 points. That difference may not sound like much, but even a 2-point average drop across a large population can mean thousands fewer strokes and heart attacks every year. That is why doctors see Amlodipine as a powerful tool in controlling blood pressure. Still, numbers on a blood pressure monitor are not the only thing patients care about. How you feel day to day matters just as much, and this is where side effects become important. The most common problem linked to Amlodipine is swelling in the feet and ankles. Doctors call it bilateral edema. It happens because Amlodipine relaxes the arteries that carry blood away from the heart, but the veins, which return blood to the heart, do not relax in the same way. This imbalance allows blood and fluid to pool in the lower legs. Over time, that extra fluid leaks into the surrounding tissue, and the ankles begin to swell. If you have ever noticed your shoes fitting more tightly by the end of the day, even when your weight is stable, that may be edema. The Cleveland Clinic notes that about 1 in 10 people taking a standard 10 mg dose of Amlodipine will experience this swelling. It is more common in women, and the risk goes up with higher doses or long-term use. Dizziness is another frequent complaint. This sometimes happens because of orthostatic hypotension. That is a sudden drop in blood pressure when you stand up quickly. People describe feeling lightheaded or a bit unsteady for a few seconds, especially in the morning. Fatigue is also reported. Some patients say they feel more tired than usual, even when they are getting the same amount of sleep. Others describe a kind of sluggishness that makes routine activities harder. Less often, Amlodipine can cause mild nausea, stomach discomfort, or daytime drowsiness. Most of these effects are not life-threatening, but they can interfere with daily comfort. It is not uncommon for patients to ask their doctors to lower the dose or switch medications because of these ongoing symptoms. When you step back and look at the big picture, amlodipine is both strong and reliable. It consistently lowers blood pressure, and for many people, it works without major problems. But it carries a higher chance of ankle swelling, dizziness, and tiredness compared to some other options. And the higher the dose, the more likely these side effects become. Doctors consider this carefully when prescribing. Sometimes the solution is as simple as lowering the dose. In other cases, combining amlodipine with a diuretic, a medicine that helps the body get rid of extra fluid, can reduce swelling. And when side effects remain troublesome, switching to a different class of blood pressure medication may be the best path forward. So that's amlodipine. It is effective, widely trusted, and often used as a first-line treatment. But for some patients, it can be bothersome because of swelling in the ankles or a constant feeling of fatigue. Next, let's take a closer look at Losartan and see how its side effects compare. Losartan belongs to a group of medicines called angiotensin receptor blockers, or ARBs. These drugs work in a different way than calcium channel blockers like amlodipine. Instead of relaxing the arteries directly, Losartan blocks the action of a natural hormone called angiotensin II. This hormone normally tightens blood vessels and signals the body to hold on to salt and water. When you block it, the blood vessels stay more relaxed, and the kidneys get rid of extra fluid. The result is lower blood pressure and less strain on the heart. Doctors often prescribe Losartan not only for high blood pressure, but also for people with type 2 diabetes who have kidney disease. That's because blocking angiotensin II protects the kidneys from long-term damage. For patients with both high blood pressure and diabetes, Losartan can be a 2-for-1 treatment, lowering blood pressure and slowing down kidney problems. It is also used in some patients with heart failure. By lowering pressure inside the heart and blood vessels, it helps the heart pump more efficiently. So how effective is Losartan at lowering blood pressure? In large clinical studies, Losartan lowered systolic pressure, the top number, by about 14 points on average. That is slightly less than amlodipine, which lowered it by about 16 points, but still a strong and clinically meaningful drop. Even a 10-point reduction in systolic pressure can lower the risk of stroke and heart attack by 20 to 30%. So, in real-world terms, Losartan is highly effective at preventing the major complications of high blood pressure. Where Losartan differs most from amlodipine is in its side effect profile. While amlodipine is famous for ankle swelling, Losartan tends to be easier on the legs. In fact, swelling in the feet and ankles is rare with Losartan. That makes it a good alternative when patients cannot tolerate amlodipine because of fluid retention. But Losartan has its own set of side effects you should know about. The most well-known is a persistent dry cough. This happens because blocking the angiotensin pathway can affect certain enzymes in the lungs. When this enzyme activity is disrupted, it can lead to a constant tickle or irritation in the throat. For some patients, the cough is mild. For others, it is annoying enough to disturb sleep and daily conversation. Not everyone develops this cough, but when it happens, switching medications is often the only solution. Another rare but serious side effect is angioedema. This is sudden swelling of the lips, tongue, face, or even the throat. It does not happen often, but when it does, it can block the airway and become life-threatening. Patients who develop angioedema must stop the drug immediately and seek emergency care. This risk is higher in patients who have had similar reactions to ACE inhibitors, another class of blood pressure drugs. Dizziness is also a possible side effect. Because Losartan lowers blood pressure, some patients feel lightheaded, especially when standing up quickly. This is related to orthostatic hypotension, a sudden drop in blood pressure with changes in posture. It usually improves as the body adjusts to the medication, but it can be troublesome in older adults who are already at risk of falls. Fatigue is occasionally reported. Some people describe feeling a bit more tired than usual, though it is often mild. Stomach upset can also occur, with symptoms like mild nausea, heartburn, or abdominal discomfort. In most cases, these effects are temporary and fade with continued use. On the positive side, Losartan has several unique benefits. It protects the kidneys in people with diabetes, as confirmed by studies supported by the National Institutes of Health. It also reduces the risk of stroke in certain high-risk patients. And unlike some other blood pressure medicines, Losartan does not usually cause problems with blood sugar or cholesterol. When we look at the big picture, Losartan is considered one of the most well-tolerated blood pressure drugs available. It is less likely than amlodipine to cause swelling in the legs, and less likely than older ACE inhibitors to trigger severe cough or angioedema. Still, no drug is free of side effects, and patients must be alert to new symptoms after starting Losartan. Doctors usually decide between amlodipine and Losartan by looking at the whole patient. If ankle swelling is already a problem, Losartan may be preferred. If kidney protection is a priority, especially in someone with diabetes, Losartan is often the first choice. On the other hand, if rapid and strong blood pressure control is needed, amlodipine may be the more powerful option. To sum it up, Losartan lowers blood pressure, protects the kidneys, and is usually well tolerated. Its most common drawback is the dry cough, and in very rare cases, angioedema. But overall, it is a safe and effective long-term treatment for many people with high blood pressure. Next, we'll bring everything together and directly compare amlodipine and Losartan, so you'll know exactly where each one stands. We've now looked closely at amlodipine and Losartan. Both are widely used, both are effective, and both can save lives. But when you place them side by side, the differences become clear. Let's start with how strong they are at lowering blood pressure. Amlodipine is a calcium channel blocker. It relaxes the arteries directly, and clinical trials show it lowers systolic blood pressure by about 16 points on average. Losartan, an angiotensin receptor blocker, lowers it by about 14 points. That may not sound like a big gap, but every point matters. Even a 2-point difference across millions of patients translates into thousands fewer strokes and heart attacks. So in terms of raw blood pressure control, amlodipine has a slight edge. But lowering blood pressure is only half the story. The other half is tolerability. How well patients live with the medication day to day. And here's where the paths diverge. With amlodipine, the most common complaint is swelling in the feet and ankles. About 1 in 10 patients on a standard dose will notice this problem. For some, it's mild. Shoes feel snug at night. For others, it can be uncomfortable and discouraging. Dizziness, fatigue, and sometimes nausea or drowsiness also occur. The higher the dose, the more likely these effects become. Losartan, on the other hand, is much less likely to cause swelling. That makes it attractive for patients who already struggle with edema or for older adults worried about circulation. But Losartan has its own trade-offs. A persistent dry cough is the most common side effect. Not everyone gets it, but when it shows up, it can be hard to ignore. Another rare but serious risk is angioedema, sudden swelling of the lips, face, or throat. It doesn't happen often, but when it does, it's dangerous and requires immediate care. So which drug is worse? The truth is, it depends on the patient. No two people respond the same way. Doctors look at the whole picture before deciding. For example, if a patient already has kidney disease from diabetes, Losartan may be the better choice. That's because it not only lowers blood pressure, but also protects the kidneys long term. If a patient has angina or needs quick, strong blood pressure control, amlodipine might be preferred. If swelling in the ankles is already an issue, Losartan is often safer. If a patient has a history of severe allergic reactions, doctors may avoid Losartan and use another drug instead. In practice, doctors sometimes combine the two. Pairing a calcium channel blocker like amlodipine with an angiotensin receptor blocker like Losartan can give strong blood pressure control while balancing out some of the side effects. But that's a decision only a healthcare provider can make, based on the patient's overall health and medication history. The most important takeaway is this: both amlodipine and losartan can be excellent choices, but neither is perfect. Amlodipine is powerful but comes with a higher chance of swelling. Losartan is easier on the legs but carries the risk of cough and, rarely, angioedema. The right choice depends on your body, your health conditions, and your doctor's judgment. So what should you do if you are taking one of these medicines? First, do not stop it suddenly. High blood pressure is often called the silent killer for a reason. It damages arteries quietly for years. Stopping your medicine on your own could raise your risk of stroke or heart attack. Second, pay attention to your body. If you notice swollen ankles, unusual fatigue, dizziness, or a nagging cough, bring it up with your doctor. These side effects are real, and your doctor can often make adjustments to help. Third, stay consistent. Blood pressure drugs work best when taken at the same time every day. If you miss doses, you won't get the full benefit, and your numbers may bounce up and down. And finally, remember the bigger picture. Lifestyle choices still matter. Eating less salt, staying active, avoiding smoking, and keeping a healthy weight can all boost the effect of your medication and may even reduce how much medicine you need. So, we've compared amlodipine and losartan. Both lower blood pressure, both can be life-saving, both can be life-saving, but their side effects are very different. If you or someone you love is taking knowing what to watch for, knowing what to watch for, could make all the difference. If you found this video helpful, give it a thumbs up. Give it a thumbs up. It really helps the channel grow. And don't forget to subscribe to MedDose Explained for more doctor-level explanations of the medicines you take every day. That way, you'll never miss our next breakdown of side effects you should know about. And one final reminder. This video is for educational purposes. It is not medical advice. Always talk with your own healthcare provider before making any changes to your medication. Stay informed, and I'll see you in the next video.